Good morning, good afternoon, and good evening once more. Please let me know if you can hear me once again. Can I just see some thumbs up?
Can
Or
hear
just say
you.
okay?
Okay.
All right, wonderful. Thank you so much. A great welcome to everybody that's tuned in this afternoon. I am your moderator for today's webinar called Unlocking Your Research Potential, Crafting a Compelling Abstract. My name is Miriam Chishachimba. I'm the moderator for today's session, and I'm so excited that you could join us this afternoon. So I'm going to share just a little bit about myself, and then I'm going to introduce our stellar panelists. I am a communications professional specializing in advocacy for gender equality and health equity. I've mostly worked in the Sub-Saharan Africa region. I'm a Global Health Corps alumni. I was placed at PATH, Zambia, as a communications officer under the Malaria Control and Elimination Partnership in Africa project. I recently completed the Youth Exchange South to South program, where I served as a communications officer with the Uganda Girl Guides Association in Kampala. And now I'm back here in Lusaka, Zambia, serving at Women in Global Health Zambia as a chapter leader overseeing media and communications coordination. I'm also currently serving as the chairperson of the coordination and publicity subcommittee of the 11th National Health Research Conference, which is scheduled to take place later in October this year. With that said, let's jump right into our discussion today. Crafting a compelling abstract is a crucial skill for researchers, writers, and professionals across various fields. A well-crafted abstract serves as the gateway to exposing research. It also provides a concise summary that captures the essence of your research or article and entices readers to explore further. Today, we're joined by three esteemed panelists who bring a wealth of experience and expertise in crafting compelling abstracts. Let me just take a moment to introduce them. First, we have Dr. Mazianga Lucy Mazavaliwewe, a public health practitioner and researcher. She is the Director of Public Health Policy Diplomacy and Communication, as well as the Senior Partnership Advisor at the Zambia National Public Health Institute, ZNPHI. Dr. Mazianga is a seasoned public health officer and researcher. She has over 27 years of extensive experience in virology, epidemiology, and strategic communication. She is a scientific author with over 150 publications and 5 authored books, focusing on mental health and social behavioral change communication. Dr. Mazianga is recognized as a crisis communications expert, and she's played a very pivotal role in establishing the Zambia National Public Health Institute and the Africa CDC Southern Africa Regional Collaborating Center, and she serves as the inaugural editor of the Health Press Zambia. Her contributions extend globally, regionally, and nationally in disease confirmation, outbreak response, and policy direction. She was recently honored with the Stand Big Bank Zambia Anakazi Women in Health Award in 2022, and recently co-chaired the Conference for Public Health in Africa 2023, which hosted about 5,100 delegates. Welcome, Dr. Mazianga. It's great to have you. Could you just kindly take a moment to tell us a bit more about the work that you are doing and to say hello to the audience?
You are muted, Doc.
Apologies for that. I didn't unmute.
Thank you so much, Miriam, for the warm introduction, and welcome to this important webinar. I'm excited to be on this forum to speak about what we can do with the information that we do as researchers. There's a lot of work that we do, surveys, actual research, and even just, in our daily work, we encounter some very important information. And a lot of times it's secluded to ourselves as reports and, put in our drawers, gathering dust. And yet this information is key and critical in decision making. So I'm happy to be here to discuss about how we can compress some of this information to create an abstract, for instance, that can be presented at an important conference. Thank you.
Thank you so much, Dr. Mazianga. We're looking forward to hearing more of those thoughts. Our second panelist is Dennis Ernest Sesanga, a research scientist at the Uganda Virus Research Institute. Dennis is currently pursuing his PhD at Wageningen University and Research and conducting studies focusing on the effect of mobile health communication on stigma and retention in care among youth living with HIV and are linked to care in Uganda. He has a public health background, and Dennis has a special interest in science communication and the use of information communication technology for community health. He is a Global Health Corps alumni, previously attached to Intra Health International, where he spearheaded the activation and the adoption of the Education Management Information System under the USAID-funded Strengthening Human Resources for Health project. The IMIS is an ICT management tool that integrates people, technology, and practices in the process of collecting, capturing, and processing data from different sources to generate information to aid informed decision-making for operation and managerial functions of the education and sports sector. He is also currently supporting knowledge management and capacity building at AfriDec. A good afternoon to you, Dennis. It's great to have you here today, joining us all the way from Entebbe in Uganda. Could you take a moment to tell us more about the work that you're currently doing at the Uganda Virus Research Institute?
Thank you very much, Miriam, for the warm introductions. As you already said, I'm Dennis. Yeah, I'm a research scientist here at Uganda Virus Research Institute, currently working as a knowledge management officer for the institute, supporting the Eastern African Consortium for Clinical Research, but also I'm also doing my own personal research, which has just been read to you out there. So the Uganda Virus Research Institute is a very big institute that was started in 1936 by the Rockefeller Foundation, and it went on to expand from doing research on yellow fever to influenza, to work on Zika, the Zika virus, and other viruses around. So we support a number of regional labs within East Africa, and yeah, I'm glad to be here. Thank you.
Thank you so much, Dennis. We hope to dive into a little bit more of the work that you've been doing. Our third panelist is Stephen Nonde. He's a scientific writer at the Zambia National Health Research Authority. Stephen is a global health corps professional, bringing expertise in research, monitoring, evaluation, and knowledge translation to his work. He has a specialized focus on nutrition and HIV, and he has provided a lot of support to various health programs. Currently, he is serving as a scientific writer and research coordination officer at the National Health Research Authority here in Zambia. And Stephen plays a pivotal role in policy brief development, research dissemination, grant writing, and capacity building for public health professionals. He is an alumna of the Global Health Corps Fellowship, and he previously served as a capacity evidence-based decision-making underscores his significant contributions to the field and his commitment to improving health outcomes globally. Greetings, Stephen. It's great to have you join the discussion this afternoon. Could you just take a moment to say hello to our audience and tell us a bit more about the work that you're doing at the Zambia National Health Research Authority?
Thank you very much for that introduction, Miriam. There's very little to add after such an extensive introduction. But pretty much what I'm doing now is the work that I do, support capacity building of health professionals and researchers, particularly in scientific writing and also in knowledge translation. So I'm really excited that we're able to do this. I'm also excited about some of the great things we are doing for this edition of the Zambia Health Research Conference. Excited to be here. Thank you.
Thank you so much, Stephen. We hope to hear more about that work that you're doing. In today's session, our panelists will share their insights and strategies for creating abstracts that stand out. We are going to discuss the importance of research dissemination, but we're also going to lean a little bit into understanding abstract guidelines in general, as well as the requirements. We are also going to look at some key considerations for abstract reviewers. What do reviewers typically look for in an abstract? And we're also going to just look at some tips and tricks for submitting clear and concise abstracts. And Stephen will be able to give us a brief at the end of our chat today about navigating abstract submission to the 11th National Health Research Conference in case you're interested in submitting your abstract. So I'd like to mention at this point that this is the first discussion in a series of webinars that will lead up to the 11th Health Research Conference 2024, which will be held later in October this year under the theme Sustainable and Resilient Health Systems, Accelerating Progress Towards Universal Health Coverage in the Face of Service Delivery Challenges, Emerging Diseases, and Pandemics. It's going to take place between the 15th to 17th of October in Lusaka at the Mulungushi International Conference Center. Throughout the webinar, please feel free to use the chat feature to just ask questions and share your comments, and we'll be able to address some of the questions that will arise during the dedicated question and answer session at the end. So without further ado, let's begin the discussion and just learn how to craft abstracts that leave a lasting impression. I'll start with you, Dr. Mazianga. Given your extensive experience in public health and research dissemination, could you elaborate on the significance of research dissemination in influencing policies and the policymaking process and just the governance sector in general? I would love to hear from you. Since you have been working in crisis communication as an expert for so many years now, what strategies do you recommend for disseminating research to diverse stakeholders, particularly policymakers, to ensure that the decisions that are being made are evidence-based and that they're assisting public health initiatives?
Thank you, Miriam. You raised very pertinent and important questions. And indeed, as part of your responsibility, speaking to the policymakers remains key. I think what's important to know, aspect to research dissemination is key in sharing your findings with necessary stakeholders. So today we're talking about policymakers and the governance structures. And the important thing is that we want to influence their policy-making processes or decisions, and also the real-life applications that they put this information into. And this is not just a Zambia thing. This is a global, trend with the insistence on evidence-based decision-making as the best practice approach. And, ensuring that you are disseminating key evidence, important evidence that will impact to those decisions that are being made. Even within Zambia, we've seen and heard our leadership insist on, providing evidence before we even present a policy brief. It should not just be, oh, I feel that this should happen, and therefore this should be the policy. No, we should have researched and found that this, if we pushed this policy, it would definitely have an impact, on the lives and livelihoods of our people. And so, just emphasizing that, providing these policymakers with evidence-based information will help them or inform them in their decision-making processes for the policies that they need to strengthen or to create as new policies. And by disseminating these research findings effectively, our policymakers are able to access the latest information in good time for good decisions, timely decisions, but accurate decisions based on proof that these things would work accordingly. Furthermore, we know that research dissemination contributes to the development and implementation of effective public health policies and interventions, as well as strategies. And so we do know that policymakers rely on this evidence to design the different policies or approve the suggested policies that will definitely address the public health challenges, putting them in priority order, and allocating adequate resources, or strategically allocating the resources because you have given the evidence that this is the best way to allocate that the resource. And of course, it also helps to build public trust in government institutions, as well as foster community engagement in these public health initiatives, because people know that, oh no, they've shown that actually, this is the right thing, or the research has shown that this is the best way to deal with this. And when you disseminate that information to the policymakers as well as the public, it brings about that important trust. Also allowing for collaboration among the different stakeholders as they work with the policymakers, and so on and so forth. You asked me a second question, which was, in the area of crisis communication, and to see what recommendations I can give in effectively disseminating findings to the different stakeholders. And I think you emphasized on policymakers. Well, there are quite a number of strategies that could be used, but I'll talk into a few of them looking at the amount of time that you've given me. But I think what's most important is know your audience. When you know your audience, then what information do you want to impart to them? What do you want to influence among the policymakers? And once you know that aspect, then you need to tailor your messages. So when you do your research, you have a lot of information that comes out of it. But what is important for the policymaker? From that research, you may have information for the public, you may have information for the program officers, and then information for the policymakers. So if you're talking to the policymakers, you need to pull out from the information, what are the key messages that I need to get to the policymakers? What do I want to influence among the policymakers? And so even the language is different. What you will share with your scientific colleagues is totally different from what you must share in terms of language. It may be the same information, but how you package it, how you want to share that message with the policymakers is different. The language, you must understand the language that they understand and be able to package your information in that aspect. And beyond that, remember, we have policymakers at different levels. And remember, Zambia, the way it is decentralized, you have the national, provincial, and so on. So there are different levels. You also have the civil society and so on and so forth. So you have to have different communication channels to be able to disseminate and reach as many as them as possible at the right time. And remember, even our MPs, for example, who are key policymakers in Parliament, before they go to agree on something in Parliament, they would have discussed it with the members of their community. So you must have packaged also to the members of the community so that they can assimilate and understand and can influence the decision-making process. And that, you know, knowing that they'll be represented by the policymakers, but they would have influenced that. So the channels that you must use are vast, you know. So you've got the media is the common one, but you also have those engagements where you sit on a round table with the policymakers and the people who will be affected by that policy, so that you can reach a consensus and foster a good policy document. Of course, there are issues of partnership with intermediaries. And that's what I was saying, for instance, the people who are going to influence or your policymaker to make that decision on their behalf are the intermediaries. They must know. The civil society who push the agenda for us, they must know. So even before you go to just the policymakers, make sure that the intermediaries are also in sync with that policy so that you can influence that. So Miriam, I mean, there are quite a number of strategies, but looking at the time that we've been given, I think I'll end at that. Also emphasizing on a two-way communication. You need to deliberate when you sit at that round table. It's not a one-sided communication where you just say, this is what must be done. So there must be a round table to discuss and articulate and have all the parties understand what you're trying to bring out and influence their decision.
Thank you so much, Dr. Mazianga. We're already learning so much. We'll definitely come back to some of the issues that you brought up later in our conversation today. I would like at this point to just get some thoughts from Dennis on a similar question, but more bended towards the perspective of the researcher. So from your perspective, Dennis, why do you think it's crucial for researchers to actively disseminate their findings? What insights have you drawn from your work, for instance, when you were working on the mobile health communication and HIV stigma among the youth in Uganda, that you can speak to when it comes to highlighting the need to disseminate research? Also, perhaps as you answer that question, you can also think about telling us how you believe researchers can effectively leverage digital platforms and technology to disseminate their findings to a broader audience and just facilitate knowledge translation and uptake in the communities they serve, given your background in communication science and ICT for community health.
Okay, thank you, Miriam. Yeah, in regards to dissemination of the work by research scientists, first I'll speak about my research. My research is about the effect of mobile health communication on stigma and retention in care amongst young people who are living with HIV and linked to care in Uganda. So if you were a researcher like me who had done their work and you were asked such a question, there are many things that will come to your mind. The first one of which would be to inform future research in the field. Like if I come up with my conclusions and I find some gaps, and I think for those who'd like to engage in the same area that I've been engaging in, I'll probably give them leads where they could focus their area so as to further achieve the target. For example, which if we speak of the UNAIDS 95-95, ensuring that it's achieved by 2030, I will have to make sure that I clearly let other researchers know where the gaps I came across so that it's easy for them to refine their work. Then the other one is to improve and also inform practice, because previously, like right now, there's been a study about the usual standard of care whereby scientists get to attend to these, let me say these the patients who are visiting these facilities for treatment, and they are, let me say, just coming every 6 months to get their blood drawn, and then they get to check their CD4 counts. There are new technologies like use of point of care, whereby as soon as they visit the facility and they are bled, they get to know their city of county instead of waiting for 2 to 3 months or even 6. So you see, if such research is done and the findings are disseminated, we'll have a lot of we will have new knowledge that's been shared, and many scientists will be doing their work in a better way. And also, the other reason why it should be disseminated is to improve, like the earlier speaker did share about policy debates. If you're to ensure that these policymakers have informed policy discussions, it will be very good to share your findings so that the directions they get to take are informed, and also we will be able to support the development of better policies that will save on the scarce and limited budget that's provided for the work. And also, if we are to feed into research across different disciplinary boundaries, it would be good to share your findings, because you find that right now they're talking of one health policy that's coming up in different countries. So if we are to share how our work is impactful, let me say when it comes to climate change, agriculture, and they're talking how can preservation of the, let me say for example, of the green cover support the reduction in the spread of HIV, and let me say improve also women empowerment. If you get to share your work in HIV, and another one shares their work about, let me say, agriculture and the need to preserve the green cover that's already there, and if we do combine those findings that are interlinking, then maybe we can be able to collaborate. And then the other reason why you may need to share your work is basically for accountability. We know that most of this research that is done, there's always somewhere a donor or a funder. So when you get to share your work, it's one way of accounting to the donor that you have actually done the work and you've accomplished the objectives that you set out. Then coming down to the second question, you asked me about how scientists can effectively disseminate their work. Yeah, there are very many platforms that they can use. Usually, the main known one is the journals. So for all scientists that have done their work that has been ethically approved, it's always recommended that you showcase your work in a journal that is approved. There's some who may share their work through the media, but that has to depend to what kind of audience that you're talking to, and who do you, and what kind of action you want to be taken. So you have to choose the right medium of engagement. And then in regards to there are social medias that have come up. All scientists are recommended to have right now, from the lessons that we picked from the previous pandemic of COVID, it's always key to have an X account, previously known as Twitter, so that you get to share your position. Previously, most of us scientists were fond of doing our work and we keep it in the cupboards, but now it's recommended that you share your findings so that we get to do away with misinformation, like what happened during the COVID era, whereby different people knew different things, and most of the scientists who had the facts were keeping them. So being in the places of information, be it online, TikTok has come up. Many people are using YouTube, putting out tutorials, working on success stories. All those are ways in which to have your work out. And obviously, through publications, through writing short stories or sharing of success stories, those are ways in which the work can be shared. Thank you, Miriam.
Thank you so much, Dennis. That was very insightful and informative. We have to take advantage of the available platforms today to disseminate our research and even just carry on conversations that matter. In the digital age, everyone has the power to say something that will bring an impact to their industry and work. We're going to come back to that thought a little bit later. But for now, I would like us to shift the conversation to how crafting a compelling abstract can aid effective research dissemination and knowledge sharing. Stephen, you have not spoken yet. Could you shed light on some key components that researchers should consider when crafting an abstract? I feel like this is the meat of this conversation today. I would like to hear, drawing from your experiences in scientific writing and research coordination at the Zambia National Health Research Authority, are there any general guidelines that can be followed? And as you tackle that question, would also like to hear from you. You've been deeply involved in research coordination and knowledge translation. What do abstract reviewers typically look for when evaluating submissions, and how can researchers just effectively tailor their abstracts to meet these expectations?
Thank you very much, Miriam, for your question. To begin with, I like what the previous speakers have spoken about in terms of what you can use to sort of speak to, is it policymakers or community members? An abstract is basically the ticket that allows you to speak to an audience that can do something about the findings of your research. Typically, we accept abstracts so that presenters can have an audience with policymakers at a research conference such as the Zambia Health Research Conference, which is coming up in October. I would say from my experience that the beginning point in crafting any abstract is ensuring that your abstract is aligned with the conference theme and the subsequent sub-themes of that particular conference. For this year's conference, our theme, as was earlier highlighted by you, Miriam, is accelerating progress towards universal health coverage in the face of service delivery challenges, emerging diseases, as well as pandemics. So your first question as you craft your abstract is, do you have work that speaks to that particular theme? And do you also have work that speaks to the subsequent sub-themes that we've developed? And we've developed these sub-themes, many informed by the WHO health systems building blocks. So you need to ask yourself that question. It is the starting point. And you will appreciate as I continue that the reason why you need to ensure that your abstract is aligned with the conference theme is because one of the criteria that the reviewers are looking for is relevance. We are hosting arguably, the biggest conference in the country. This is an international conference that comes every 2 years. We need to ensure that the abstracts that come in and the subsequent presentations that will be done will be of relevance and will be of use to policymakers, decision makers at various levels, be it at community, policymakers, or program officers, like many of us may be. The second thing you need to look at once you've answered the question, this particular abstract is actually in line with the conference theme, is you need to understand the submission guidelines or the guidelines that have been set by any particular conference. For this particular conference, the scientific committee has provided 2 guiding documents. The first one is the submission guidelines, and the second one is the abstract management standard operating procedure. At this point, I'm sure my colleague will share a link to the submission guidelines. So the submission guidelines is pretty much your next stage when you are able to know that this abstract is aligned with the conference. So you need to understand the submission guidelines. And as we already know, the required format for any abstracts is an introduction, your methods, your results, and a conclusion. These are our submission guidelines articulate those sections. They even provide guidance on what should be included on those sections. So it is extremely important as researchers, as we plan to craft our abstracts, that we consult these submission guidelines and we find out what exactly is required in each particular section. The other thing that the submission guidelines also provide, they provide information on the types of abstracts that we'll be accepting for the 11 ZHRC. We'll be accepting 2 types of abstracts, best practice abstracts and original scientific abstracts. There are some differences between these two, and these are outlined in the submission guidelines. But one thing that I would like to emphasize is the ethical considerations that are accompanied by these 2 types of abstracts. With scientific abstracts, all scientific abstracts are required to be accompanied by either ethical approval or an ethical waiver. This is extremely important. Mind you, the Zambia Health Research Conference is a conference that is being hosted by a regulating body. So issues of ethics are extremely important, and abstracts that do not adhere to this will be disqualified at the initial screening stage. The second type of abstract that we'll be accepting is the best practice abstract. The best practice abstracts ideally highlight practices within an organization, practices within a particular program that improve the performance of that particular program. Typically, these type of abstracts will not be accompanied by an ethical approval and ethical waiver. But instead, you will notice that on our submission system, we do ask a few questions because we want to make sure that we don't leave any stone unturned, and that we ensure that even best practices are adhering to ethics. So you will notice questions around collaboration. If your best practice involves collaboration, you would have to ensure that you provide evidence of that particular collaboration with other institutions. You will also be required to provide proof of permission to use particular data. So it may so happen that your best practice is relying on data that is perhaps in the custody of the Ministry of Health or other government institutions. You will notice that our system will elicit for this type of information. These are pretty much the really important issues when it comes to crafting your abstract. Firstly, like I said, you ensure that it's aligned with the conference theme. Secondly, you ensure that it adheres to the submission guidelines, and more specifically, that it adheres to the ethical issues. This is extremely important. We want to ensure that the research which is disseminated at the upcoming conference is ethically sound research and research that was approved. And in going to Miriam, your second question, what do reviewers look for? So typically, reviewers will look for clarity. Is this particular abstract clear? Are the sections of this abstract clear? Are they clearly itemizing or elaborating the information that should be in these sections? I'll just take us very quickly through some of these sections and what a reviewer will be looking for. For instance, the introduction. In the introduction, your reviewer will most likely be looking for 2 very important things. What is the problem? And secondly, what are the objectives of that particular scientific research, or be it a best practice? In the method section, you'll be answering a couple of questions. You'll be answering who was involved in your study, what was done, how was it done, when was it done? These are the important questions that you clearly need to come out in your method section. And the results, you'll be elaborating what it is that you found. What are the results of this particular research or this best practice? And last but not the least, you have the conclusion. In the conclusion, and this is extremely important for a conference of this magnitude, we are interested in 2 things. The first one is, what do your results mean? This is extremely important. The second one is, what are the policy or practice implications of your results? This is the reason why we're having this conference. Remember, like Dr. Mazianga said, you need to have your audience in mind. This conference is going to attract not only health researchers, but it's also going to attract policymakers, decision makers across the entire health system. And it is extremely important that abstracts that see the light of day are abstracts that have relevant policy and practice implications. So this part is extremely important, and this is something that the reviewers will be looking for. Some additional criteria that the reviewers will apply are things to do with relevance, which I already spoke about. Does this particular abstract speak to the conference theme? Does it address an important public health issue? Another additional criteria that the reviewers will be looking at is creativity and innovation. Does this particular abstract present an innovative approach in either in science or an innovative approach to solving the usual public health problems in the case of best practices? I think that pretty much speaks to how you go about it, and also what reviewers will be typically looking for throughout this particular process. I thank you very much, Miriam.
Thank you so much. That's such great insight. Does your research speak to a particular public health issue or a policy issue? How relevant is it, and what can be derived from there and be practically applied? Thank you so much, Steve, for that. And staying on the subject of crafting a good abstract, I would like to hear from Dr. Mazianga on some tips and tricks for submitting a clear and concise abstract. Now, it's interesting to note that, Dr. Mazianga, you have over 150 publications, and you've authored 5 books, mostly focusing on mental health and social behavioral change communication. And we're excited to hear from you today on how researchers can effectively tailor their abstracts to resonate with policymakers. I know we're going back to the same story, policymakers and stakeholders, but could you just give us some of the tips and tricks that researchers can incorporate in crafting an abstract? Also, I know that you are also the inaugural editor of the Health Press Zambia. What do you typically look for in the abstracts that you publish? What can you share with researchers today to help their abstracts meet the standards of scientific journals and publications? What has worked in your experience? How can they maximize their chances of acceptance and dissemination?
Thank you so much again, Miriam. Also, just to take advantage of the platform and indicate that beyond social behavioral change and mental health, I've also done quite a lot of work around epidemiological, disseminating epidemiological findings, particularly around virology and vaccine preventable diseases. You raise a very important question, and I think sometimes people wonder why in their thoughts they think they've done such a good job at writing an abstract and yet it's rejected. Of course, there are standard generic rules around abstract writing, and I think Stephen articulated to most of those, in terms of knowing the theme, the sub-themes, in terms of knowing the structure that the conference, the way to structure your abstract. You need to know the conference you are going to present at, and what structure have they requested. And so the note to the authors, you must pay particular attention. Are we able to, being disturbed? Are we able to mute? Thank you so much for that. Yeah, so we need to be able to read into the instructions for the authors so that we align to the conference. Yes, there are generic structures for abstracts, in terms of, the title, the methodology, and all those things. But we must know that this particular conference, this is what they're asking for. So importantly, as we generate our abstracts, first of all, your title must be clear. It must be engaging. Additionally, they'll tell you, don't put more than 12 words in your title. If you can't say your title the whole title in one breath, then it's too long. So clear and engaging title. When somebody sees it, they're interested, and they already know in what context or what the subject matter is. So we talked about, putting in the context or the background or the introduction, depending on the conference. They will either call it a background or an introduction or a context. It's important that you provide a brief overview, giving an idea what the research problem is or what is the issue you're trying to address. And in this way, the policymakers and stakeholders are able to understand what this research is about, what is important about it, and how relevant it is to them. And then, when you are doing your results, it's important that you highlight the key findings. Sometimes people want to write everything that they have found, even that which is not relevant to the objective or the conclusion or the message that they are trying to send. So you need to ensure that you highlight those findings that are clear to the easy understanding by the policymakers and the stakeholders who you are trying to address, focusing on presenting the most important findings that directly implicate the decisions that the policymakers must make. I think what's also important is for the author to be able to emphasize the implications of these findings on policy and, of course, governance practice. So the author must clearly articulate the implications of these research findings for this kind of people they are speaking to, highlighting what the research addresses that is relevant to policy challenges or information that is potential policy solution, a recommendation that will influence a policy or contribute to, the evidence-based decision-making as we spoke to earlier on. And as you are speaking to policymakers, you need to recognize who they are. So using of technical language in this space, it just distorts everything. Don't use, jargon or technical language or abbreviations that they won't understand as policymakers or stakeholders. You need to just use plain language, clear, straightforward, an explanation that will communicate your findings to them effectively, influencing their thoughts. And I remember one of my dissertations when I was doing my first degree, one of my lecturers was very happy with it because your language is so simple, anybody can read and understand. That's what we look at even in terms of the health press, because in terms of the health press, we speak to beyond the program people, we also, or the public health people or the scientists, we also speak to the public, we also speak to the policymakers. So we want you to use, non-technical language for some of these articles, especially when you want to talk to people like the policymakers. And then it's also important that you highlight actionable insights in your findings or in your recommendation. Even as you conclude, you recommend things that will, based of course on your research findings, that will help the policymakers understand how they can practically apply these research findings to their work and decision-making processes. I think it's also important that in your abstract, you address demonstrate clearly the policy relevance and potential impact of the research that you have given, discussing, of course, how this research contributes to addressing the pressing policy issues, improving public health outcomes, also advancing, the goals of the relevant stakeholders. It's important that you consider the audience priorities and needs. As we said, know your audience. Even as you prepare your abstract, you need to remember, who are you targeting? Who do you want to talk to? And what message are you trying to send out to them? It's important that, your information is concise. Of course, you are complying to the style that and format that your conference organizers have indicated in the notes to the authors. And then you don't want to put too much. In fact, in terms of abstracts, most abstracts will give you 250 to 500 words, and you must comply within that. If you can do an abstract within 350, you have a good abstract. But remember to be clear, write it carefully in sequence so that, it's not confusing the people who are listening to your, to your abstract. Basically, I think that's what I would emphasize on in terms of how do we ensure that our abstract is effective and efficient to influence the policymakers. Thank you so much.
Thank you so much, Dr. Mazianga. That was very clear to all of us as well. Very insightful. I'm sure we've picked one or two tips and tricks, and we can see perhaps so we can make our next submission a little bit better. I'm sure you can agree with me that that was very helpful. I'd like to hear from you, Dennis, again, particularly from your experience on projects that you worked on to integrate information communication technology for community health. I know that you are currently supporting knowledge management and capacity building at AfriDec. What practical advice would you offer researchers in leveraging digital tools and platforms to enhance the clarity and accessibility of their abstract submissions? I know you spoke to digital platforms earlier, but now perhaps we can look at accessibility and submissions. How can researchers learn to be digitally savvy and also to just have some practical tools on abstract submissions?
Okay, yeah. So just to add to the insights shared by previous speakers and what I did share, yeah. First, we'll ask ourselves, what are these digital tools? What digital tools are there that are at hand that we ought to use already? I know for anyone who's in research by now, it would be key for you to have it's called an open research and a contributor ID identifier. By default, if you have that and you have your profile on there, it helps, like it would help you to have the scores of your research and the work that you've done go up. And that's an ORCID account. And also in regards to updating your profile on social media, for those who already have accounts, it's key for you to go up. And if you're on X and you indicate that you're a researcher, right now they've come up with a new way of profiling yourself so that you separate yourself from being a bot to a real person. So if you update some of those things, those statements on your profile, it helps you as the researcher be easily identified. And then also LinkedIn, I already shared about LinkedIn, that is key to update your profile and the works that you've done. That most of these social media platforms, digital platforms speak from other digital platforms. They speak to each other. So if you've listed your work and you've done it somewhere else, it scores a lot more. Like, for example, if you're doing a Google search of the work, it scores a lot more if it's been mentioned somewhere else in the search results. And coming down to the recent, since most of you, I would say, are Africans here, there's a new platform called AfriDec that I and the team I work with. So it's basically an Ubuntu platform that's going to be that supports sharing of work from amongst scientists from within the sub-Saharan region, and it's basically focuses on peer-to-peer work. If I would recommend that you open up an account on that platform and get your work shared and get the discussions going. So on that platform, it has mainly people who are interested in research work, and you can easily get to collaborate and engage, have focused discussions that are targeted. So even it has groups, groups that are focused for those who are into for example, ARA, coding. You can have discussions there. Those who are into community engagement, and you get the discussions going. So that's the AfriDec platform. And also in terms of sharing research, it's most of the work that is on that platform is shared broadly beyond to more than 3,000 people on that platform. So the platform has about more than 750 plus members, community members, so who are interested in research. Yeah. Over to you, Miriam.
Thank you so much. That's amazing that AfriDec is trying to amalgamate research efforts in the sub-Saharan Africa region. That is a platform that is needed. I saw somebody in the comment section just say, can we get a link? You will get a link, and I'm sure Dennis or someone from the authority will provide you with a link to the AfriDec platform. There's a lot of resources to be shared there. Thank you so much for pointing that out, Dennis. I'd like to come back to you, Stephen, as someone who is very passionate about knowledge translation and capacity building. I know that you're doing a lot of policy brief development in your work currently, and you are also supporting grant writing. I would like for you to also just concisely share your insights on how researchers can effectively align their abstracts with funding priorities. I know Dr. Mazianga spoke to this a little bit earlier, and Dennis touched on it, but how can researchers align their abstracts with funding priorities and policy objectives, and how can they increase their chances of securing funding and just driving real-world impact with their research? If you could just elaborate on that from your experiences.
Thank you very much, Miriam. I think maybe to start with, I'm excited to say that this particular research conference that we're having is informed by real-world priorities. And many of you agree with me that universal health coverage is a goal that has been set as part of the Sustainable Development Goals, which is due 2030. In coining the theme for this particular conference, we consulted a number of strategic documents and policy documents. One of them being the National Health Systems. I'm trying to just remember it, but it's the National Health Strategic Plan, rather, 2022 to 2026. This was one of the key documents that were consulted, as well as the SDGs 2030. We also evaluated other documents from Africa, from the World Health Organization, as well as SADC. And we only have about 6 years left until the 2030 deadline. So already this particular conference is aligned with a World Health priority. Submitting to an abstract to a conference such as this one already aligns with the policy agenda, and could increase your chances of connecting and networking with other researchers who are working on trying to achieve or accelerate progress towards the 2030 deadline. So I'm excited to say that, because this particular conference, already just participating in this conference allows you to participate in a real world problem and agenda. The other things that researchers can rely on is just keeping up to date, participating in research, as well as reading research that is being done by other researchers. For instance, Dr. Mazianga spoke about the health press. This is another opportunity for you to really find out what the real public health priorities are in the country as people publish in the health press. Other opportunities also is to attend other dissemination meetings that the authority hosts. So besides the Zambia Health Research Conference, which is sort of our flagship and our biggest dissemination meeting, we have other dissemination meetings that happen on a quarterly basis as well as a monthly basis. We have the scientific quarterly meeting. This is something that you can attend, participate in, and keep abreast of what are the current policy issues. The answer to this particular question will really differ depending on somebody's interest in the work that they are generally involved in. I would tell you from my experience last year and the funding opportunities that we responded to, there seems to be a proliferation in request for funding when it comes to the use of artificial intelligence in aiding decision making. So this is from my experience, and it's biased from the sort of work we were doing last year. Somebody working in infectious diseases will tell you that it's probably funding in infectious diseases as well. But from our experience and what we've noticed from the RFPs that we attempted last year, there seems to be a lot of interest in how, artificial intelligence and other forms of digital transformation can sort of be used to aid decision-making in public health. Another area that we've seen a lot of interest over the last few years is funding around gender inclusivity, gender mainstreaming. All these are areas that we've seen a lot of interest over the years. But I guess maybe in a nutshell, and as I close, the best way to really know where the money is, for lack of a better word, is attending dissemination meetings. And the ZHRC is a great opportunity. Like I said before, it's aligned with global policy priorities. Achieving universal health coverage is a global agenda. And submitting your abstract to this particular conference and subsequently being able to present it will put you in the same room, not only with policymakers, but also with potential funders of your respective research. Thank you. Over to you, Miriam.
Thank you so much. That's very, very insightful. Even if you've gone a little bit ahead of the conversation in sharing some of the alternative platforms, we may come back to that thought. In closing, we may come back to that thought. In the meantime, Dennis, I'd like to quickly hear from you, maybe in under a minute. I know you did not speak to this yet, but Dennis also happens to be the co-founder of the Public Health Ambassadors Uganda, a successful advocacy initiative that has secured several rounds of funding through research. And and we just want to know, Dennis, can you give thoughts on how researchers can align abstracts with funding priorities? What has worked for you, especially from an initiative that you co-founded from almost nothing, and then just being able to get to a place where you've had several rounds of funding because of your research and your work? Could you share some pointers with us today?
Yeah, so what we've been able to do, what has helped us, some of them were mentioned by Steve earlier on, knowing what in his previous submission. But if I'm to be brief, one of the things that has helped us updating our strategic plan, a 5-year strategic plan, with first looking at the problem within the community where we are, and then aligning our work, our activities with what we are able to do, looking at our capacities and coming up with a very strong capacity statement. It's one thing to come up with an abstract, but then when your capacities are totally different. So you have to look at those two and see, like, okay, what are our capacities? What can we do as us, as an organization? And then what are we missing? Then you align yourself with what you're proposing. Because if the donor or funder gets to look at what you're proposing to do and your capacities are lacking, then they may not actually believe that it's you who's doing the work, or that you can do the work, or you get the funding that you need. Then the other thing that has also helped us has been, has been basically focusing on the problem within the area and understanding it deeper. Yes, so we've been able to do an on-ground needs assessment for some of the projects that we've done, and updating it with real-time numbers, getting data from the ministry, and ensuring that what we are dealing with is actually up to date, and it's easily convincing. Thank you. Over to you, Miriam.
Thank you so much, Dennis. I love what you highlighted about marrying your capacities with what you highlight in your abstract. That was absolutely an amazing pointer and a very practical as well. Would like to hear from you, Dr. Mazianga, perhaps in just under a minute. could you add a public sector lens to the importance of crafting an abstract that is in line with funding priorities? I know you spoke earlier extensively about this, but maybe in under a minute, how can a researcher align the abstract to funding priorities in the public sector context? What has been your experience? What has worked for you?
I think in my experience, what I've noted is that a lot of people, especially upcoming scientists or public health practitioners, want to repeat what other people have done. And you find that their research questions are just changing in terms of maybe the population that is being worked around or the site. And so with that in mind, they are not providing competitive research priorities. And so in terms of the funding space, may not get that that approval, because it's nothing really new to the body of knowledge that you're bringing on the table. And so my advice is that we need to look, when you look at other researches that are done, usually at the conclusion, they'll talk about the gap in the findings that they had. And so there are certain questions that are yet to be answered. And so you can pick up from there and ensure that, you push that agenda, or think of something else that is innovative and interesting and, importantly, relevant to the situation of the day. Thank you.
Thank you so much. That's very, very helpful. Speaking of abstract visibility, I know Stephen has touched a lot on the upcoming conference, but there is an exciting opportunity that lies ahead for researchers present here today. We are inviting you to take a look at the opportunity to submit an abstract to the 11th Zambia Health Research Conference. It will be happening in October. Like Stephen pointed out, it's an interdisciplinary and international conference. It's held biannually, and it brings together researchers and scientists and health professionals, policymakers, and the general public as well. And it is convened by the Zambia National Health Research Authority with support from partners. And right now, preparations are currently underway, as we're only about 165 days away from the scheduled date of October 15th. Stephen, I know you've labored to explain, but perhaps in just under 2 minutes, could you briefly run us through navigating abstract submission to the 11th Zambia Health Research Conference 2024? What should researchers expect to encounter in the submission process?
Thank you very much, Miriam. I will try to speak as quickly as possible. We will be using the Oxford Abstract Management System for collecting submissions of abstract this time around. This is a sophisticated system that allows you to create an account, start your application, and even complete your application much later in the process, maybe as you consult other colleagues and also as you just go through the process of crafting your abstract using some of the insights from this particular webinar. Also, this particular system allows us as Secretariat to send you reminders and also, just guide you throughout the entire process of you submitting your abstract. I would also maybe like to make another addition. Please adhere to the abstract submission guidelines. We will be sharing the standard operating procedures, and you will note in the SOPs that we have a screening process that will be done before these abstracts are later moved on to the reviewers, who will then be scoring your abstracts. We also are working on improving our turnaround time. Please do expect to hear from us no more than a month after the submission deadline closes. This will allow you to do all the necessary preparations. We'll also have tutorials available on our website. Please engage with the website. Please engage with the Secretariat through our emails. It's very exciting. I think we've done a lot of innovative things this time around, and we're hoping that our new system can support you adequately and better. Miriam, thank you very much. Excited to receive more abstracts.
Okay, but perhaps before you close that thought, you spoke earlier about other avenues for research dissemination. So apart from the Zambia Health Research Conference, what other avenues are available to disseminate research through the authority?
Thank you very much, Miriam. We have a number of other dissemination platforms. And earlier mentioned that we have the quarterly scientific meeting, which happens at the end of every quarter. This particular meeting is open to all types of research and is not necessarily restricted by any theme, which is the case with the ZHRC. You can make these submissions and ensure that these submissions are made before the last week of any particular quarter. So we have 4 of these meetings in a year, and we invite all health researchers to make use of this particular platform. We also have monthly dissemination meetings, but these are usually informed by emergencies. So we had the COVID-19 emergency very recently, and we used to have these monthly meetings. These meetings have ceased, but in the event that we have another emergency, we will continue these monthly meetings. Also, lastly, we have the Zambia Health Press, which is obviously managed by Dr. Mazianga and the team at ZNPHI, but NHRA does provide support. And in particular, we do provide support, especially when it comes to policy briefs. So if you do have a policy brief that you want published, you could also use the avenue of the Zambia Health Press, which is an indigenous journal and a health bulletin that provides information on surveillance data. So those are some of the platforms that we have. And like I said, if you consult those platforms on a regular basis, you will, for a lack of a better word, know where the priorities are and also where the money is. So I do encourage you to take advantage of those particular dissemination platforms in addition to the ZHRC. Thank you, Miriam.
That's brilliant, Stephen. Thank you so much. I've noted the excellent tech support from Secretariat at the authority in answering some of the questions I've seen in the chat. Someone was asking about what is the deadline for abstract submission. That's just to say we have opened up now for just 10 minutes for a question and answer session. If you have a burning question, please simply raise your hand and you will be given an opportunity to unmute. You'll be unmuted and then you can speak. But I saw some questions around the deadline for abstract submission. Stephen, could you quickly speak to that?
Thank you very much. Thank you very much, Miriam. The deadline for abstract submission has since been extended to the 26th of this particular month. So we are still looking forward to receiving more abstracts from you. Thank you very much.
Thank you for that. I also saw a question on how can I register, and I believe Secretariat has thrown a link in the chat on where you can register to attend the 11th National Health Research Conference. I would like at this point to just get questions from our audience. Are there any pressing or burning questions? You can just go ahead and raise your hand and you'll be given an opportunity to speak. I have a question here from, I can't see who that's from exactly, but it's for Dr. Mazianga. And it says, as a seasoned crisis communications expert, what advice would you offer researchers for effectively communicating the significance of their findings to diverse audiences, both within and outside the scientific community? I believe you touched on that already, but maybe you can add some thoughts to that, Dr. Mazianga.
Thank you very much. Maybe just to emphasize, like you said, I touched on it, but I can just re-emphasize. First of all, we need to recognize, is this information that I have relevant to the situation? And usually when it comes to crisis communication, that happens during an event or a crisis, an actual crisis. So who should you be talking to? So there are different stakeholders that you need to be talking to. The people who are affected, the people who can resolve the crisis. So, but the packaging of that information, it can be the same information, but it has to be different according to who you are speaking to. So are you speaking to the person or the group of persons who need to resolve the situation? Or are you talking to people who are affected but need to be calmed down or need to change their behavior for us to be able to control the emergency or the crisis and things like that? So what's important is, what information are you trying to communicate? When you know the information that you're trying to communicate, who are you trying to communicate that information to? That will help you make a decision on how to package it and how to channel it. And like we said earlier on, there are various means of communicating this information. It can be through media engagement, it can be through community engagement, it can be through written, information in a paper or a journal, and so on and so forth. So the things that will guide you are who needs to hear that information, why do they need to get that information, and how will it impact on their action after that. Thank you.
Okay, thank you so much, Doc. I saw a question in the chat about methods of payment for the conference. Stephen, are you able to just clarify the system of payment for the conference?
Thank you very much, Miriam. So we do have a page on our website which allows you to go through the process of registering and as well as making payment. You will be able to make your payment through any of the mobile money facilities that we have, as well as using your debit card. So these are the main methods of payment. You could also go a further step of depositing into an account, but the main payment methods are those that I mentioned. Thank you.
Thank you so much for clarifying. I saw another question about zero-rated. I couldn't see the question quite clearly. Would you be able to have a look at that for me? While you're looking that up, a question for Dennis. Dennis, how can researchers position their work for regional visibility? You spoke about the AfriDec platform and how you brought together about 3,000 researchers from the Africa region, especially sub-Saharan Africa. How can researchers position themselves for regional success and global impact?
Yeah, I think one of the ways was already mentioned by Steve, by participating in various events, different research engagements, so that you get to know what other researchers are doing and networking with them. And when you get to network with them, there are some of these researchers on different platforms. I think in some of my earlier submissions, I did mention about like being on X, being on sharing your work on LinkedIn, and making sure as a researcher you have an Orchid account to ensure that you're a legitimate researcher. And then also ensuring that you have an account on ResearchGate. That's another way in which you can be able to share some of your work. The other platform that I highly recommend is the Global Health Network. That's actually a project that started from the Oxford University. They have different hubs that they've opened up. There's one specific for Africa, and then others that are specific on different diseases, COVID, HIV, data management. So being on those, you'll be able to know what's happening, and even other people may be able to know and network with you and get to know about the work that you're doing. So then the other new way that I've seen coming up, actually I saw it grow a lot more during the pandemic, the use of YouTube to share most of their work. So in terms of success stories, in terms of success stories, and sharing them on the social media platforms. So as a researcher, it would be ideal for you to be evident and active on most of those platforms. Yeah, over to you, Miriam.
Thank you so much. And I'm sure we have more burning questions. Let us use the various avenues that have been highlighted to continue these conversations, especially on our LinkedIn and other social media pages. We can continue to have these discussions, and you can always direct any further questions that you might have to those platforms. As we conclude, did you have something to say, Dennis?
Yes.
I can see that.
Yes, and also just to add to that, like I said about AfriDac, as AfriDac, we're going to have we already have different platforms that have been created on the same platform, discussion engagements. So even for this conference, we will be, this conference has been of interest to us. We look forward to having different themes, sub-themes discussed on the platform. So for those of you interested, if you look at all the sub-themes, we'll create up different platforms where you can engage with other researchers and see what they're talking before the conference. So we start discussions as the conference comes by. Thank you. Over to you, Miriam.
Thank you so much for pointing that out. That's an amazing opportunity, and I don't want to get into it too much, but Secretariat will be able to share a few more details, and look out for more information on just how to engage with various platforms that have been shared by Dr. Mazianga and Dennis. We'll try to get that information to you so that you don't miss out on creating an extensive network with fellow researchers. We have come to the conclusion of our discussion today, but I will just gather some key takeaways from our speakers as we come to a close. Dr. Mazianga, I think that you have really helped us in understanding the public health landscape and just how to position a good abstract to be able to have impact on the public health sector and also to have impact on policymakers. Could you just give us a take-home thought about writing a compelling abstract, and also just the impact of effective research dissemination on public health outcomes? In just under a minute, a closing thought.
Thank you so much, Miriam, and thank you to everybody who's been on the platform. I think that when you put everything together that everybody has spoken to, in summary, the most important thing is that don't pocket your research findings. Always find space to disseminate them, and disseminate them widely. From your research, there are different stakeholders that can benefit from there. My emphasis was on the information to policymakers, but you can also send it to other stakeholders such as the public, the program managers, and the different public health practitioners. So package it correctly for the intended purpose, to the intended audience, clear, concisely, exciting to the ear, so that it can also be implementable. Thank you very much.
Thank you so much, Dr. Mazianga. Dennis, could you just share some closing thoughts, something we can go home with on knowledge translation? And I feel like we're just going back again to digital platforms and research dissemination, but maybe just a closing thought on how we can leverage these platforms to impact the well-being of our communities in under a minute.
Yeah, as a researcher, you should have a a well laid out, you should have well laid out knowledge of who your intended audience is and your cues to action, how you want to engage them, and that will determine what information you're going to read. If it's to journalists, you have to know that you have to drop the jargon. If it's to students and colleagues, then you can keep the language. And then if it's to funders, then you have to make it sense. You have to make sure that what you're giving them makes sense to them so that they can fund your work. So have your cues to action well detailed out and target your content to them with that intention in mind. Thank you.
Thank you so much, Dennis. Stephen, we want to hear a take-home message from you. Can you share a quick tip or piece of advice for researchers who are submitting abstracts for the first time, especially those submitting for the first time, regarding some common pitfalls to avoid or some other overlooked aspects that has not been considered in this conversation?
Thank you very much, Miriam. I think the takeaway message I would give, especially to those who are doing this for the very first time, is maybe perhaps to accept two things. The first one is that research is a learning process. I think everyone in research has had to do something for the very first time. So I would ask them to accept that one truth, that it's a learning process. And then the second thing is that they have to be deliberate and intentional. And I know my previous speakers have spoken to this. You have to be intentional. And intention requires that you look through the abstract submission guidelines, that you have your audience in mind already. These are the main pitfalls, not knowing who the actual audience is. The actual audience in this case are policymakers, program managers, and funders. Those are the people you need to keep in mind. You keep your language very simple and ensure that you're able to inform the actions that a policymaker can make, that a program manager can make, yeah, those are pretty much the audience that you need to keep in mind. It's a learning process. Keep it very simple and keep the audience in mind. I think these are the important ingredients for you being successful even on your first try. Thank you, Miriam.
Thank you so much, Stephen, for that closing thought. And in closing this discussion, I would really like to extend our gratitude to our esteemed panelists for just taking time out to share their invaluable insights this afternoon and evening or morning, depending on which part of the world you tuned in from. Thank you, Dr. Mazianga. Thank you, Dennis. And thank you, Stephen, for sharing your insights and your expertise with us today. We also extend our thanks to each and every one of you, to our amazing and engaged audience. You've been engaged from the beginning, asking questions and interacting in the chat box there. It was a beautiful thing to see. Thank you for your active participation and insightful questions. I would just like to remind you that today marks the first in a series of insightful sessions and webinars leading up to the 11th National Health Research Conference in October. So we want to continue this journey together and just explore key topics and preparing for the conference. So look out for information on our next webinar. And for those who are interested in learning more about abstract submission, guidelines, registration details, as well as partnership opportunities, and more information related to the conference, we invite you to visit our conference website, have a fine look at it, and see what is relevant to you. We want to hear from you. We want to engage with you. There, you are sure to find all the necessary information that will be useful to this very transformative event. We look forward to your continued engagement and participation as we work together to advance research, knowledge, and innovation in the field of public health. Thank you for joining us, and we wish you all the best in your research endeavors and preparations for the upcoming conference. Have a lovely evening.
Thank you.
Thank you. Bye.
Thank you.
Bye. Bye.
Bye.
Thank you.
Bye.
Bye.
Bye. Thank you.
Bye. Thank you.
Bye. Thank you.
Bye. Thank you.
Thank you, everyone. Bye.
Bye. Thank you.
Bye. Say bye. Thank you.
Bye. Thank you.